Now, even as many places are loosening some distancing rules, there are concerns about what happens in the months to come. Will there be a resurgence of COVID-19? Will it be worse than what we've seen? Today on CBC Radio's The Current, BC's Chief Medical Officer, Dr. Bonnie Henry, told host Matt Galloway that Canada must be prepared.
You know, the optimist in me would like to think that maybe it will go away and it'll the virus will mutate and won't become as. But you know what? We've never had a pandemic in recorded history that has not had a second wave. So now's our time to regroup, learn as much as we can over the coming weeks and months, and prepare.
For more on this, I want to bring in Dr. Michael Warner. He's the Medical Director of Critical Care at Michael Garron Hospital in Toronto. Dr. Warner, appreciate you being there. Thank you. How confident are you that public health officials are prepared to detect and to deal with a potential second wave of the virus?
Based on what I've seen so far, my confidence is not there. We need to test much more broadly. We need to contact trace more effectively, make sure patients are isolated, and make sure we support those who have difficulty self-isolating because of social circumstances.
Why are we not testing more broadly?
Well, I was listening to a clip from Premier Ford, and it's not clear from him why we aren't, and I look forward to learning why we are not. We need to test really an order of magnitude more broadly, and not just test patients who are present to assessment centers who are sick or pre-symptomatic, but general surveillance within the community is really important so we can identify where COVID-19 is hiding, flush it out, and protect the public from patients who are infected but don't know it. And without testing, there's really no one to contact trace. So testing is the most important thing, and then contact tracing thereafter.
I know that you've written, I think you think, and you tell me, that you feel as though politicians are, I don't know, are they getting a pass on this? Are they not being held to account enough when it comes to testing and contact tracing and just dealing with this pandemic generally?
You know, I'm not going to weigh into politics. All I care about is that things get done properly. So when I go to the media, it's really a call to action. This isn't just going to go away because we wish it away. We have to do hard work. And it's not about people not wanting to do the right thing. It's about execution and performance, leadership, organization, sometimes finances. We need to get all those things right to get ahead of this, or else it's going to be a smoldering pandemic for months and months, which is going to hold back the economy and the healthcare system from getting back on its feet. So it's not about blame, it's about getting things done properly.
Well, let me rephrase the question, because I don't want to get into the politics of this, but it is the politicians that ultimately make the decisions about public health guidance and all of these public health situations that you find yourself in your hospital, that the community finds itself in. So do they need to change in terms of the messaging, in terms of the action that they are taking?
So if we look back over the past 10 weeks, there's been a disconnect between what frontline healthcare workers have been saying and what politicians who have been informed by public health officials have been doing. And I think the closer links between the front lines and public health officials might help inform politicians to make decisions that we think make sense medically, whether it was physical distancing, the need for PPE, or now to have a more robust public health infrastructure. So let's come together as a healthcare system. Let us who are seeing the patients who actually have COVID provide public health with the information they need to do their jobs more effectively. We're willing, we're able, because we want to stop having to treat patients with COVID and get back to life as it was before.
I want to talk about Ontario versus Quebec in terms of Quebec seems to be much more aggressive when it comes to reopening, even though they were harder hit than Ontario. What do you make of that?
I think without adequate testing infrastructure, contact tracing, all the public health measures that I mentioned, it would be unwise to assume that things are going to get better just because we want them to get better. And sending kids to camp or opening up schools, etc., I think could have negative consequences unless there's a much more robust public health infrastructure to identify asymptomatic and pre-symptomatic people in Quebec than there is in Ontario. I understand the mental health aspects of this, that people need to get back to work and need to socialize with each other. But the second wave is coming, as Dr. Henry said before me, and it just depends. What we don't know is how bad it will be. And I think the economic, mental, and financial consequences of a second wave could be far worse if we open things up too soon.
And Dr. Warner, I just want to ask you specifically, because I understand you are also a doctor for an overnight camp. So what have you told your camp about the safety of operating this summer? There won't be overnight camps, we know, in Ontario, but there will be day camps in Quebec. There could be some version of day camps in Ontario. Do you think they would be safe, or do you think they just cannot be safe?
So overnight camp is a non-starter. Before Premier Ford said it's a no-go, I told the camp that I work with that it's a no-go. Day camps, it's a little bit more difficult. I mean, part of camp is being together and close together. We've seen how long-term care facilities that are congregate settings have had issues with this pandemic. And I think when there's no infection prevention and control expertise at a summer camp, it's going to be hard for them to abide by the rules properly. And it just takes one child to really shut down the whole thing. And for me as a parent, it's not a risk that I'd be willing to take. And if it is going to happen in Quebec, I expect that they do everything possible to protect the children and the parents they go home to.
A final question to you. We're also almost out of time, but what about this? It seems as though what Quebec is doing is saying, look, we have to, there are risks here. We're concerned about mental health. We have to take a little bit of a risk by opening things up more. In Ontario, that doesn't seem to be the decision. It seems to be we need to keep, sort of slower and steadier than what Quebec is doing. What do you make of that balance that seems to be in play?
So it is a delicate balance, and I can understand both sides of the argument. I think unless we have a plan, a public health plan, whether it's the economy or camps or sports, they're not going to happen in a safe way or in a long-standing, durable way unless we have the public health infrastructure to enable that. So although it's not very exciting, the public health piece has to come first. And I think the Ontario approach makes more sense medically. And I guess we'll see what happens in Quebec as they are a little bit more loose with restrictions.
Dr. Warner, always good to get your insight. Thank you very much. That was Dr. Michael Warner. He's the Medical Director of Critical Care at Michael Garron Hospital in Toronto.